There it comes.
Be in this profession?
Very long, 20 years, since 1985.
How many obese patients do you treat per month on average?
50 to 40%.
Then, how many methods of slimming do you know?
Oh, medically there is methods of slimming. Exercise, diet, and some diet pills. 3 main methods, and surgery.
For surgery, they remove the fat.
Yeah.
Liposuction.
Yeah, that's right.
Which one do you trust the most?
Okay, the most consistent one would be diet and exercise one.
Which one do you think is the most effective?
The most effective, I would say that to be, as I said before, I think most of the patients can be treated by diet and exercise.
Okay.
But for those very, very, very fat patients who are unable to lose weight, they can try surgery, and it can be quite effective.
How do you advise patients on slimming down?
Slimming is not an easy process. Firstly, you must the patients must want to lose weight. You must motivate the patient.
But what if they don't follow what you say?
Yeah, that's what I said. You must motivate them to want to lose weight. If they do not want to lose weight, I cannot do anything. I can only tell them that, okay, obesity can cause medical problems like heart disease, stroke, cancer, difficulty in breathing, arthritis.
Can it cause mental problems in your area?
Your question is interesting because yes, obesity can cause low self-esteem.
Depression.
It is sometimes related to depression. So much so that some people who are obese may have some social problems. For example, they may face some discrimination at work, or they may find it difficult to find boyfriend or girlfriend. And yes, certainly obesity may be related to some mental illnesses like depression, anorexia nervosa, binge eating, because these people, when they are sad, they use food, as a comfort, they eat to comfort them,
So how do you define obesity?
How do I define it? Okay, obesity is generally defined as a BMI of more than 23.
23. Can it lead to death?
Yes, definitely you can bring problems. And you can even develop what you call sleep apnea. Because this level obesity is definitely a risk factor for sleep apnea. Where these people, they are so fat, they stop breathing in their sleep and no oxygen goes to their brain.
Then they die.
They won't die, but they will get increased risk of heart attacks and all that kind of thing. High blood pressure. Oh yes, obesity is linked to high blood pressure as well. And of course, abnormal lipids as well. High blood pressure, abnormal lipids as well. Lipids, and abnormal cholesterol.
Are the movements of obese patients restricted? like cannot walk, cannot anything.
What do you think?
Those very fat one lah.
Of course lah.
Those guy.
They get they can get arthritis of the knees, you know, can be quite bad, you know. Of course, definitely. Can you imagine the obese people what if you are very fat instead of sitting on one seat you have to sit on two seats, you know.
So do you think the obesity rate in Singapore is high?
Yes, it's high. I think you have to get the figures somewhere lah. So it's around.
Why? About 10%?
Higher.
Quite high lah. I think more than more than that. I think.
Why do you think this is so?
Oh, because of our modern lifestyle.
Fast food restaurant.
Yes,
Luxury.
we eat and don't exercise, and we eat the wrong things,
Like
like fast food, fried things, too much carbohydrates, convenience foods.
So do you think the government is doing enough to help reduce the obesity rate?
in Singapore.
Yes, the government is doing quite a lot. I think they promote exercise. They try to have many campaigns. You know, they tell people to eat correctly, take more fruits and vegetables, eat less fatty food.
So what is the best way to prevent obesity? Yes, better people.
The best way to prevent obesity, okay, right. Obesity is of course partly due to genetics. So you should lead a healthy lifestyle from young.
Do you think the BMI is an accurate way to find if one is obese?
There is more accurate ways, which is very complicated and very scientific, and therefore not practical. So the other measurement that you can do is the abdominal fat ratio. That is to say, the ratio of the waist to the hip, the waist-hip ratio. If I'm not wrong, if it's more than 0.8, that increases your risk to heart attacks.
So is obesity a hereditary?
Yes, most likely there is a hereditary. Some people do have the obesity gene.
Do you think NS can help obese people slim down?
Oh, definitely NS. When I went for NS during my time, I slimmed from 65 kilos to 50 kilos. 15 kilos I lost during BMT.
But I thought some people will grow heavier.
Unlikely lah.
Those skinny ones go like if you got fats, right, then you convert them to muscles.
They're converted to muscles, but overall I think the BMT is probably still quite tough. You exercise a lot, and no matter how much you eat, you still lose weight.
Okay, thank you. That's the end of.
Okay, anyway, you can have a look at my talk, and learn more about health.